It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheetham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheetham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheetham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everyone, and welcome again to another live round of Katz's Corner here on WABC Radio in New York. I'm your host, Dr. Aaron Katz. We're live at 1-800-848-WABC. If you've got a question about your health under the belt, give us a call at 1-800-848-9222. Good morning, Philippa. How are you?
Good morning. How are you, Aaron?
I'm all right. You feeling okay today?
I'm feeling good. I'm just laughing at our newsreader. Poor old Scott Salado is looking horrified that we have a show about the prostate. And Mitch Levy, we taught him everything about PSA issues and prostate issues. He could have run the show, but Scott, well, it's a baptism by fire for you today.
This is not horrifying for me.
No.
Are you kidding? This is health. This is what if you're not healthy, you're not happy.
That's right. Yeah.
You know.
And you keep yourself healthy, Scott?
I try.
Yeah. Well, you look healthy.
I live with a vegetarian. That helps.
Oh yeah. Well, but you are you vegetarian?
No, I'm not. But
right.
Do you know much about the prostate? Could you take the course? I mean, Mitch was an expert.
What about a crash course here? What can you teach me in 5 minutes?
Okay, how many R's in prostate? 1 or 2?
How many R's in prostate?
That's a good question.
One, excellent.
Right, very good. Yeah.
You're on the way. You're on the way to becoming an expert.
So many people say prostrate.
Absolutely.
I have a prostrate condition. Well, it's finally nice to meet the face and the gentleman here, Scott Salado, who we hear so much about you on IMUS. And sometimes they give you a hard time. I guess that's their shtick, though, right?
They like do, but this seems to be the show with the KY and the rubber gloves. That
right.
show, it's misplaced, perhaps. But this is the show for that.
All I can say, Scott, is be relieved that this is radio, not television, because the things that we ask you to do in the studio, we get our guests in the studio. The Religion on the Line guys, they always look a bit nervous when they come in at the end of the show.
Oh, it's good. It's all good.
All right, Scott, well, have a wonderful day, and
thank you.
Wonderful to meet you. Give our best to our friend there at all our friends at the IMUS show, Dagan and Don as well, Bernie and all of them. I want to remind everyone that our prostate health seminar, which will be on June 15th this year, is up and running. The site is there. It's menshealthseminar.com. It's updated, ready for registration, right, Philippa? We have a wonderful seminar planned for all of our men and their spouses this year. We're going to give them time also to socialize with each other, meet with some of the vendors, and also our invited lecturers. There'll be prostate lectures, there'll be lectures on sexual health, there'll be lectures on bone health, sleep health, and everything to keep our men healthy. This coming June 15th at the Garden City Hotel. That's menshealthseminar.com.
That's right. This will be our 4th seminar, and there's a number of very loyal attendees from the previous 3 who will be there.
Yes, they do.
But it's always good to have new blood, and we only have a limited number of places. So go to menshealthseminar.com and register.
That's absolutely right. And we are going to the phone calls because the phones are lit up, Philippa, this morning right away. Many listeners are getting up every week to listen to Katz's Corner at 1-800-848-9222. So let's go right away. Our wonderful call screener, Jennifer, there. Let's go to, C. Charles in Brooklyn, who has a question. Good morning, sir.
Yes, doctor. About a few months ago, I was diagnosed with high blood pressure. And I'm 72 years old, and I never had a problem having an erection. Now, because of these high blood pressure pills, I can't get an erection.
Right.
Is there a blood pressure medicine out there that doesn't do this to men?
What's the medicine that you're on, sir?
Bystolic, Bystolic. I
don't know that. Do you know that, Philippa? Do you know that medicine?
No, I mean, that's the trade name. Do you know what the generic is for that, Charles?
What was that?
What's the generic for that? Do you know? Do you know
I don't know. They didn't give me. They usually give me a generic for it if it's available, but they gave me the brand name. It's
Charles,
Bystolic.
Have you checked your cholesterol level, Charles?
Yes, it's very very good. 141.
That is very good. And do you have any other issues with your heart? Is it just high blood pressure? Because high blood pressure in itself, is one of the predisposing factors, not just the medication, although there are a lot of medications out there, Charles, and I would recommend that you discuss this with your internist. Have you done that? But
yes, I told him, and he seemed not to, just they want to give me Viagra, to take. And I used to be say 172 pounds, and I stopped at night eating junk, looking at TV. I lost 10 pounds because I go to the doctor every 3 months, to get checked up, just to keep. And I got high blood pressure. I lost 10 pounds, and I got high blood pressure.
How tall are you, Charles?
I'm about 5'7.5".
And how much do you weigh?
164 pounds.
It's not too bad, actually. Lost 10 pounds.
Yeah, I know.
Are you doing any? Are you doing any aerobic exercise? Are you running the treadmill, Stairmaster?
No. I don't do no real exercises.
Well,
I watch my diet, and that's about it.
Well, I think that's key. I mean, what's one of the things that you can certainly add? I mean, in terms of getting more blood flow on a nutritional level. Eating less red meat would help.
I don't hardly eat no red meat.
Okay,
I try to stay away from red meat.
Okay, what about arginine? Have you ever thought about using arginine 3 times a day, an arginine supplement? You can get in a health food store. That can help restore some blood flow to the small arteries that lead to the penis that allow you for erections. Because you don't have a nervous problem. You don't have a neurological condition. You're not diabetic, I assume, right?
No. Yeah. Listen, I was unbelievable. We used to say, look, I'm going to be good until I'm 90, And then all of a sudden I get this, go to the doctor, I have high blood pressure. They give me a pill, and here I am. It doesn't, I can't get there. You know what I'm saying? And it's kind of depressing.
Charles, I'm pretty sure the blood pressure medication that you're taking is what's called a beta blocker. And many patients who take beta blockers do have the side effect of erectile dysfunction. Patients often also complain of cold hands and feet when they're on a beta blocker. So first thing I would do is tell your doctor that you've got this side effect, particularly if it's only started since you've been on the medication. And he may be able to change you to a different type of a blood pressure medication called a diuretic. As Dr. Katz said, the side effects we often see are often related to the underlying problem, not the medication. But if it's related to when you started the medication, that may be an issue. Also, next week, our expert guest on Katz's Corner is Dr. Brett Mellinger, who's an expert on erectile dysfunction. And if you tune in next week, we'll be talking about medications that affect sexual health.
Good.
Okay.
Oh, very, very good. Because I woke up early this morning just to talk to you guys.
Well, after you hear our show next week, you'll wake up with an erection. Okay. That's what we hope. That's what I thought you were going to say. I woke up with a blank. Fill in the blank. All right, Charles. Thanks for tuning in.
Thanks a lot.
No problem. Let's go to Tom.
Care.
Tom in New Jersey. Good morning.
Yes, good morning, doctors.
Good morning, Tom.
Pleased to speak with you. I am 65 years old. I have atrial fibrillation. I'm now in AFib 24 hours a day since June. They have me under rate control. There's a slight leakage in the valve, the mitral valve, and they're not quite sure whether that's the cause of the AFib or not. But that's not the question. I'm just giving you some idea. I'm thin, 161 pounds, very fit, still walk an hour a day, and I feel no symptoms from the AFib. I was just diagnosed with prostate cancer. That's the focus of my attention. I just gave you the other for some background. The prostate cancer in September, the PSA was 10.6. PSA in December was 12.6. They did a biopsy last week. 12 cores, 2 cores had cancer, one 17%, one 80%, a Gleason score of 7, primary number 3, secondary number 4. And now the doctor left in my hands to decide what to do. He said I could do nothing,
Yeah,
but
well,
I'm too young and fit. He said I could do robotic surgery, open surgery, or radiation. And I wonder if you'd be kind enough, not to my particular case, but something in my parameters, what you might advise.
well, and Tom, do you have any? Okay,
doing.
Tom, do you have any trouble urinating at all? Is that an issue for you?
Absolutely not.
Okay.
No. The prostate is a normal size. It's not enlarged, and it's unfortunate. Were enlarged, I would have sought treatment sooner. Now.
Okay, and Tom, do you know if you're looking at the biopsy, is the cancer on one side or is it on two sides?
Yes.
It's on one side.
It's on the left side.
Left side.
As I'm looking at it, the two top, they're not quadrants, but out of the 12
all right.
segments, it's in the top two, and the second one, rather in the middle, is where the 80% is located.
All right, Tom. Well, what I would do, if it were me, if you were my patient, I would recommend first I would get an MRI 6 weeks after the biopsy to see if there's anything on the other side, and I would consider talking. I would talk to you. I'm a little concerned about your heart condition, and your age is what you said, 66?
65.
Yeah,
65?
I mentioned that because that comes up immediately because of the surgery and the
So 65, but you have some areas that are high volume. To me, I would get an MRI, take a look at it, and I would consider you either for something like the CyberKnife program that we have at Winthrop, or a focal ablation, which is a focal cryotherapy that I do quite a bit for you, which would be an outpatient procedure. You would have to have some anesthesia, but you don't have to be completely out as you do for the robotics. Philippa, what do you think?
I agree. I think, Tom, well done on being so well informed. You said you'd only just been diagnosed, but you know everything about your PSA and your biopsy information. I think that's the first key issue that we always talk about on Katz's Corner, is know what you've got before you can decide about treatment options, and you're very well informed. I suspect that if you're not on anticoagulation already for atrial fibrillation,
I am.
Yeah, so that can also complicate issues when you're on blood thinners. I agree with Dr. Katz. Get an MRI. Although you have Gleason 7, which is a moderate risk prostate cancer, you're a lower risk 7. So there's no immediate urgency to choose a decision. So look at all options, get the MRI, and then reevaluate.
Yeah. It's a good
I'm very
point.
pleased that you suggest the MRI. I think that's an intelligent possibility myself. And the heart, I just undergo the biopsy. I had to be put out and off the blood thinners, the Xarelto, for 2 weeks, actually, a week before and a week after. So I survived that. So I'm hoping maybe that's as far as I need to go to get surgery if I do a CyberKnife type thing.
Well, the CyberKnife, I'm sorry, Philippa, but the CyberKnife is not surgery, by the way, Tom.
Oh.
No, it's not surgery. It's actually run by a colleague of ours, Dr. John Haas. We've had him on the show before. And although it says knife, there's really no knife. There's no surgery involved. It's 5 days of radiation. It's a lot shorter. And the side effect profile is quite good. Most of the patients do really quite well, and their PSAs do well. For patients that are looking for an alternative to the standard form of radiation, it's actually called stereotactic body radio imaging, SBRT, or CyberKnife, and I think that would be reasonable as well. The question is, do you really need treatment? What do you think, Philippa? Does he absolutely need treatment? What about the active holistic surveillance for Tom?
Well, I certainly think that there's a role for active holistic surveillance in all patients, along with other treatments as well. We can certainly address diet and lifestyle issues. We can measure your vitamin D level. We can talk about some of the foods that are prostate cancer protective and remove those foods that can aggravate prostate.
My D level, I should tell you, is 65, so it's up there. All my blood is absolutely perfect. Cholesterol 131, and I am a vegetarian, so it's a bit confusing about why you have this at all, but...
Well, I certainly think as well, you only have 2 cores out of 12. It's encouraging that they are both on the same side of the prostate. So a focal therapy that Dr. Katz has already mentioned may certainly be advantageous to you, particularly if quality of life issues like sexual function are important. Dr. Katz and I wrote the book on cryotherapy for prostate cancer. So if you want more information on the freezing technique, that may help. But I think the best thing to do is give us a call back when you've had the MRI. The other thing to say about the MRI, just to touch on what Dr. Katz mentioned about waiting 6 weeks, the reason why we advise patients to wait at least 4 to 6 weeks after the biopsy is that the MRI is looking at the capsule, and if you've had a biopsy within 4 weeks, sometimes it can give us some abnormal readings that are actually related to the biopsy and not related to spread of cancer. So to avoid that confusing factor, we say wait 4 to 6 weeks. And that's certainly one of the reasons why we're moving towards doing MRIs before the biopsy if there's concern that there really will be cancer there. But thank you very much for your call.
Excellent, excellent points, Philippa. And thank you, Tom. And again, if you'd like to get the MRI and maybe see Philippa or I, you can see us. I know you live in New Jersey, but we now have the Winthrop Urology offices open on Park Avenue. That's 81st and Park, 944 Park Avenue. A beautiful office right there. You can see one of us. And just give us a call at 516-535-1900. It's 7:18 in the morning. If you're just waking up, Katz's Corner, Dr. Philippa Cheetham and myself at 1-800-848-9222. That's 1-800-848-9222. Earlier in the show, we were mentioning that we are open for registration for our Men's Health Seminar at Garden City Hotel this June 15th. We hope to see you all there and your loved ones. Spread the word, and you can register now at menshealthseminar.com. Let's go to John in Fort Lee, who has also been diagnosed with prostate cancer and has a question. Good morning, John.
Yes, good morning, doctors. Actually, it was in June of last year, I was diagnosed with prostate cancer. My Gleason score is 6, 3 plus 3. My PSA at the time was 3. And the biopsy was 14 cores, and 3 of them were cancerous, 2 being at 50%, 1 at 10%. And
how old are you, John, did you tell us?
60.
60 years old. Have you had an MRI since then?
No, my doctor doesn't believe in it. I've had a bone scan.
No, you don't need a bone scan. You need an MRI, okay? You have early stage, low risk by the National Cancer Guidelines, the NCCN guidelines. Actually, it sounds like you're a very low risk.
But 2 of my cores are at 50%.
Okay, so yeah, I would say you're probably at low risk then. Maybe not very low risk, but you're still at low risk. You got 2 cores of 12. You definitely need an MRI. You were biopsied in June, you said? That was now, it's going on to 9 months. Have you had another PSA since then?
Oh, yes, I've had 3.
And how are those PSAs?
They've gone lower, mainly, I believe, because I've read your book and kind of followed your diet to a certain degree. There
you go. Okay.
And the last PSA about a month ago was 2.45.
Excellent. Okay. No urinary problems?
No, I frequent urination at night, but nothing, like 3 times at night, but it's livable. And my prostate size is, I believe, about 28 grams.
Okay, I'm happy about your PSA. I assume you're doing well, you're feeling well, you're eating well. I definitely think you need an MRI, Philippa. Would you do anything differently? And what about another biopsy or a PCA3?
Well, yes, my doctor is going to do a biopsy at 1 year in about 3 months.
Okay, I'm not saying that's wrong.
But the issue with the MRI is he says he doesn't he says when it's a case of close to metastasizing, then he can see something, but he says for my type, he sees no value in an MRI.
John, one of the first things I would say is that the reason we should do a test in medicine is to determine whether that test will change our management or not. And you, more than anybody else, doing an MRI would be so useful, and I'll tell you why. If the MRI shows that the capsule of the prostate is perfect and there's no suspicion on the glands that sit on top of the prostate, what we call the seminal vesicles, then you would be much more of a candidate for active surveillance than if the MRI shows any abnormality of the capsule. So an MRI would definitely influence the way I would manage somebody like you, and I think if anything it would be more important to do an MRI than a CT or a bone scan, because the MRI gives us excellent information on the prostate. Now, there are different types of MRI, and certainly in somebody like you, the better the quality of the MRI, the better the quality of the picture, the better the quality of the information. So a 3T MRI would certainly be very well worth doing. There are criteria for managing patients with active surveillance, and as Dr. Katz has mentioned before on the show, less than 2 cores, and you do have percentages that are quite high. I think an MRI would be extremely useful in this situation.
John, you also live in Fort Lee, New Jersey, I see, and we've had Jackie Brunetti on the show for our patients that live in New Jersey. She's at Holy Name. She runs the radiology center there. She's excellent and has a terrific MRI with all of the software there that is completely up to date. I trust her judgment. Her name is Jackie Brunetti, Jackie B. Listen, I strongly would consider you to go there. I don't see the downside. There's no radiation with these MRIs. And, I have to disagree with your doctor. And, Dr. and Philippa and I, we go to all of these meetings. We're on the cutting edge there. And we know and we listen to our radiology colleagues, and clearly the latest MRIs, the software packages, the technology for looking at these lesions as they get near the capsule, very, very vital and very important information. And I totally agree with Philippa here. To get a test in medicine, just to order it is useless. But if you can order a test where the outcome can change, and, listen, you had 2 cores, but maybe the cancer's grown, or maybe the doctor missed it. And, you're a young guy, and it could change. And for me, it might take you off of active surveillance.
I mean, a bone scan is fantastic for looking at the bones, but that certainly is more of a concern in people who have high-risk, high-grade prostate cancer. A CAT scan is excellent for looking at lymph node disease, but the MRI is really the best test for looking at the prostate capsule, looking at what's going on very close to the prostate. One question I had for you, John, what led to the biopsy? Because your PSA of 3 is low for your age.
Yes.
Was it a change in the PSA
right.
that led to the
yes,
biopsy?
The internist said the velocity was going up, and he'd like me to go see the urologist. And the urologist, what triggered him was my free PSA was extremely low. I think like the lowest it could be.
Okay.
And it was below 10. And he goes, if it's below 10, I strongly recommend a biopsy. And sure enough, I think it was like 6.8. And the next thing was a biopsy. And he would have removed the prostate, 6 weeks after. But I started reading books and what have you, and in my present situation.
Okay. Well, if you'd like to give your number to Mike, our producer, certainly I can call you back with the contact details for Dr. Jackie Brunetti at Holy Name. And, it's well worth at this point getting some second opinions, because we do have different views on what you've, we can't give you a specific information without reviewing your case, but certainly it looks from what you've told us that an MRI would be the way forward. Just a few minutes left here on Katz's Corner, 1-800-848-9222. That's 1-800-848-9222. You see, Philip, here's a guy totally goes against the U.S. Task Force's recommendation of not doing PSAs. A guy has no symptoms, young guy, and found to have cancer. It was lucky that they picked it up. These doctors did a very good job in detecting it very early. And now, of course, the question is, does he really need all of that treatment? He's a smart guy, went on our program, went on the active holistic surveillance program. PSAs dropped, but the question is, does he need to take the next step? And I'm not so sure. Let's wait and see the MRI. Absolutely. And the MRI in Gleason 6 disease is the test that changes the patient's management. I know Steve's on the line from Long Island. You've been waiting for a while. Good morning, Steve. How are you?
Yes, good morning.
How are you, Steve?
Yes, hi there. I'd like to ask you about the controversy over the last week, Dr. Oz, with all the information about not taking antioxidants, really limiting it since he feels that they may cause cancer, including he was talking about prostate cancer, etc. May cause cancer. Well, I haven't. I have to be honest with you. I haven't tuned in to Oz this week. Have you, Philippa?
No, I haven't. I mean, we've had a very busy week.
We've had a busy
seeing
week,
patients
Steve.
and operating. But can you give us a bit more information, Steve,
I mean,
about what he said?
Was there a new study that came out? Because I'm just not,
He didn't. He had a guest on. He didn't mention the study, and he was just saying that we're possibly over antioxidants.
All right.
Antioxidants.
Well, Steve, thanks for your phone call. I mean, Philippa, maybe we need to do some. I'll call Mehmet. I mean, I know Mehmet very well. I'll call him. I wasn't able to see his show. We're both busy during the day. I mean, you actually did a very big surgical case this week. Also want to congratulate you on doing that case with a patient that had a very large tumor in his kidney, and you successfully removed that. I know you just came over to Winthrop and did a terrific job on him. Again, congratulations on that. And I know the patient's doing very well.
I must still be showing some signs of fatigue when you thought I'd been out having a late night last night.
No, you're chipper. I know. But I'll call Mehmet today and see what that's about. We have 2 minutes.
Thanks for your call, Steve.
Thank you, Steve. And I'll talk about it next week. And next week, as Philippa mentioned, we do have a wonderful guest on who's going to talk only about sexual health in medicine. Let's go to Sharon, though. Sharon's on the line from White Plains for the last few minutes. Go ahead, Sharon.
Hi. Good morning. How are you?
Okay, Sharon.
My husband is 53. Was diagnosed with prostate cancer in 2 quadrants of 12. He had gone to his internist, and his PSA was, I think, 5.4. And so he recommended that he go to a urologist, which he did. They put him on antibiotics, I believe. They retested. The PSA was 5.2. And then they did the biopsy.
And what did the biopsy show?
Cancer in 2 quadrants.
And what Gleason was it?
3. Is that 3/3 or 3?
3 plus 3?
Right. 3
so
plus
he's
3
still
in one and 3 plus 4 in the other.
Well, he's still a low-risk guy, Sharon. I mean, 53 years old is pretty young to have his prostate removed. There certainly can be a lot of long-term side effects. Not saying that he's going to have the side effects, but before you get into a major surgical procedure like robotics, I probably want some more information. Philippa, what do you think?
Sure.
He had a body scan.
Sharon,
CT scan.
hand over your number to Mike, and we'll come back to that, and I'll give you some more information.
Okay,
Young guy,
you.
we need to know about percentage core involvement, and again,
okay.
certainly a role for an MRI, but we'll talk to you after the show.
Yeah,
Thank
I'm
you.
sorry, Sharon, we didn't get to you earlier, but this is a very important phone call, 53 years old, and again, brings up all the issues that we talk about here on Katz's Corner every week.
Stay on the line, Sharon. I'm coming back to you.
Don't forget, prostatemenshealthseminar.com. This is Dr. Aaron Katz.